Hi everyone, it is already week 5, so it's quiz 5 for top 200 drugs. So this week's topic is renal. Alright, so first drug is amitriptyline with brand name Elavil. The class of this medication is called tricyclic antidepressant, treating depression. So it is one of the oldest antidepressant class that are in the market. They're very actually effective for treating depression, but have a lot of side effects. So a lot of older drugs they work, but they come with a lot of side effects. So we try to get rid of those side effects, but with only the good effect with the newer agents. So some side effects that these tricyclic antidepressant cause are drowsiness, some anticholinergic side effects like dry mouth, dry eyes, constipation, urinary retention. So pretty much dries you up, and also cause some confusion, which can lead to fall. So this class medication is usually really reserved for when other treatment options have failed. So SSRIs or selective serotonin reuptake inhibitors such as citalopram, fluoxetine, sertraline, we talk about in other weeks. So those are the first line agent for treating depression, and tricyclic antidepressants such as the amitriptyline are kind of reserved as a second and or last line agent. Amitriptyline actually is more used for treating pain, such as chronic pain, migraines, headache, or nerve pain, more so than just treating depression. The Nasopril, brand name Lutensine, it is angiotensin converting enzyme inhibitor or ACE inhibitor. So when we talk about Ramipril or brand name Eltase from last week, so I mentioned what ACE inhibitor does. So it's for treating hypertension. So benazepril and ACE inhibitors are included in renal topic because it works mainly on renal arteries. So that's why it works. It has kidney protective effect. So I kind of mentioned last week's video as well that ACE inhibitors are the drug of choice for treating hypertension for a patient with chronic kidney disease or even patient with diabetes who which can cause kidney damage. All right, so next drug, amlodipine with benazepril. It is a combination drug with brand name Lotrel. So amlodipine is a calcium channel blocker, which is antihypertensive that inhibits calcium ion from entering into vascular smooth muscles, leading to relaxation of vessels or vasodilation. So that's how it lowers blood pressure. And benazepril we just talked about is ACE inhibitor. So both calcium channel blockers and ACE inhibitors are one of the first line agents for treating hypertension, and there are many instances that patients need more than one hypertensive agent. So it is very convenient for patients to take this combo tablet so that they have two tablets in two medication in one tablet. So it really helps to increase medication adherence. Another combination tablet medication, lisinopril with hydrochlorothiazide, or we often say ACTZ in abbreviation. The generic name for this is Zasoretic. It is a combo of lisinopril, which is ACE inhibitor, and hydrochlorothiazide, or ACTZ, is thiazide diuretic. So thiazide diuretic works on the distal convoluted tubules in the kidneys by inhibiting the reabsorption of sodium and chloride ions back to the bloodstream. So water follows sodium. So as we inhibit the reabsorption, we have more excretion of sodium, so that helps to excrete more water out of the system. So there's less blood, which means there's going to be less blood pressure. So that's how this drug works, and it's another combo drug. Another one, losartan with hydrochlorothiazide, again, ACTZ. So losartan is angiotensin 2 receptor blocker, or we often call it ARB, with thiazide diuretic. So both drugs are for treating hypertension, and brand name is Hyzar. So ARBs are very similar to ACE inhibitors. Remember, ACE inhibitor is a blocking enzyme, ACE enzyme, that converts angiotensin 1 to angiotensin 2, which is really potent vasoconstrictor. And this medication is that they're blocking ACE2 from binding to the receptor. So something good about ARB is it doesn't have the most common side effect that ACE inhibitors can cause, which is dry cough. So usually patients who didn't tolerate ACE inhibitors, they can use ARB instead. Usually ARBs are more expensive than ACE inhibitors, so we try to usually use ACE inhibitor first, and if it didn't work out for some reason, usually because of dry cough, then we go for ARB. All right, same thing. It's another combo of ARB medication and thiazide diuretic. It's combo of valsartan and ACTZ. The brand name is Diovan ACT. Same thing for treating hypertension. All right, so next drug is furosemide with brand name Lasix. It is in class of loop diuretic, which means that it works in the kidney, and the place where it works is ascending loop of Henle. So that's why it's called loop diuretic. It is more potent diuretic than thiazide diuretic, so it has more diuresis, which means it is more potent and stronger for getting water out of the body compared to thiazide. Brand name Lasix actually it means it lasts 6 hours. That's where name Lasix is coming from. So the duration of action for this medication is 6 hours. Midazolam, or brand name Versed, is benzodiazepine. So far we went over several benzodiazepines. So this one particularly only is available in IV, so intravenously given. So that means it is used mostly in hospital setting, in ICU setting, when patients are going through surgery or after surgery, things like that. So it is for sedation or anesthesia. Next one, temazepam, brand name Restoril, is another benzodiazepine used for insomnia. So all the benzodiazepine, they cause sedation, so they can be used for insomnia. Gentamicin, it is one of the quite old antibiotic. It is in the class of aminoglycoside antibiotic. It is used for many different types of infection, including urinary tract infection and endocarditis. One of the really important or severe side effect it can happen is ototoxicity, or toxicity in ear, and nephrotoxicity. So you don't have to really remember that, but gentamicin, because of the severe side effects it can happen from this, it is really important to monitor dosing and monitor patients for developing these side effects. Imipenem with psilocytin. It is a antibiotic that has two components, two medications in one. Brand name is Primaxine. It is one of the carbapenem antibiotic. You guys remember that we went over meropenem with brand name Meram. I think it was from actually week 1. So antibiotic used for many different types of infection again. So within this drug, actually imipenem is an active antibiotic, and psilocytin, the second part, it is added to this medication to prevent imipenem from being metabolized in the kidney, so that imipenem has longer time to work and be active. So remember that imipenem is the active part, whereas psilocytin is added to prevent metabolism of the imipenem. Ciprofloxacin, or brand name Cipro, is one of the fluoroquinol antibiotic used a lot for treating urinary tract infection. So one of the most commonly used antibiotic that you guys probably have seen it in community pharmacy if you work at a pharmacy. So very commonly used medication for urinary tract infection and can also be used for respiratory infection, many different types. But just remember for UTI. Nitrofurantoin, or brand name Macrobid, is another type of antibiotic. Doesn't really have specific class, so it is classified as miscellaneous antibiotic, also used for treating urinary tract infection, and it is one of the first line agent for UTI. And it is a lot of time it is preferred over Cipro because of Cipro has high rate of bacterial resistance in many areas. Okay, so next one is darbepoetin alpha, or brand name Aranesp. It is a class of erythropoiesis stimulating agent. So erythropoiesis is a process that produces red blood cells. So by stimulating this agent, it is treating anemia, especially when patients have chronic disease, kidney disease, or patient going through chemotherapy. They get an anemia. So this agent is trying to stimulate a red blood cell production so that patient can get more red blood cells. Meloxicam, or brand name Mobic, is one of the NSAID, or non-steroidal anti-inflammatory drug. So we went over a couple ones last week, such as naproxen, celecoxib, or I think we also went over ketorolac. So there are many other NSAIDs. Meloxicam is one of the ones that we use a lot for osteo and rheumatoid arthritis. Morphine, actually brand name MS-Contin, is the one for extended release version of morphine. It is opioid analgesic for use for moderate to severe pain. So morphine is kind of like a gold standard opioid that we always try to convert their every opioid's dosing to morphine to see their the strength and equally analgesic dose. So morphine is always compared to other opioids for their dosage. All right, tramadol with brand name Ultram, it is considered as an opioid analgesic, but it actually is not structurally opioid, but exhibits some opioid properties. So that's why it's classified as opioid analgesic. It also inhibits reuptake of norepinephrine and serotonin. So it has a little bit more function than just being opioid analgesics. It has less side effects compared to other opioids have, and a little bit less risk for abuse. It used to be non-controlled agent until July of 2014. That's when it became actually controlled substance. So it's in C4 class. All right. Carisoprodol, or brand name Soma, is skeletal muscle relaxant. It is used for treating acute musculoskeletal pain. It is also a controlled substance. It is in Schedule 4. It has sedative effects, very similar to barbiturates and alcohol. As you can tell from the brand name Soma, it causes sedation. It can also cause mild euphoria. That's why it has actually high risk for physical dependence and abuse. And it can also cause some very significant withdrawal symptoms after prolonged use. So really, it is not recommended to use. This drug is really not recommended for use. So there are many other muscle relaxants that can be used. So really, we should be alarmed when patients are using this drug for prolonged time. Methocarbamol, or brand name Robaxin, it is another skeletal muscle relaxant. It has greatly reduced abuse potential compared to carisoprodol we just talked about. So this one is non-controlled medication used for muscle spasm, and it can also use for tetanus. All right, the last drug is allopurinol. Its brand name is Xyloprime. It is in category of xanthine oxidase inhibitor. So xanthine oxidase is an enzyme that converts hypoxanthine to xanthine and subsequently to uric acid. So hypoxanthine and xanthine are the a precursor for uric acid. So by inhibiting these steps, by inhibiting the xanthine oxidase, which is the enzyme that converts them, it reduces the production of uric acid in the blood. So it is used for treating gout or hyperuricemia. So gout happens by having too much uric acid. So this is the main medication we use for treating chronic gout. Alright, so that's all I have for this week. So hopefully this video helps you to study for the quiz, and good luck for the quiz 5 next week. Have a great weekend, guys. Bye.